Good evening, good evening, good evening, or good morning, good night, good afternoon, whatever time you're watching this. This is Rihanna from Plan Wholesome Empowerment Group, and we're back again with another live for Mental Health Awareness Week. Okay, so yesterday you saw that I was joined by Marissa May from Beautiful Trauma, and we spoke a bit about the effects of mental health on friends and family, those around you, and what you can do to kind of be an advocate for change. Today, as you saw me post earlier on, we are going to be joined by Jericho. So Jericho, I met him last year actually. We done a few lives for a community charity. So I'm going to bring Jericho live with me and we're going to delve into discussion. This one's going to be really, really juicy. I'm just saying that. I already know. So, yeah, I'm not even going to go into it. I'm just going to let you know. I'm going to invite Jericho on now. It's Mental Health Awareness Week and there's a live a day until Saturday and then you'll see me by myself. Okay?
Hey,
Hi. Hi, how are you doing, Jericho?
I'm really well, thanks. How are you?
A little bit tired, I can't lie. Just I
Yeah,
feel like I've just finished work.
one of
But
those
I'm all
days.
good. Yes, how are you?
Yeah, I'm doing really well. I'm doing really well. Had a decent day. Wasn't too busy, and I'm ready to get into this.
Yes, I can't lie. I've been looking forward to this discussion all day because I
Yeah,
was like, how can I frame it? But whatever way it comes out, it's all going to be nuggets of knowledge, isn't it?
yeah, definitely, definitely.
All right, good stuff. So I was just saying, as I was, kind of starting off the live, I'm going to let you introduce yourself, but I was just saying how
Mhm.
we met last year through the community group, and we done a few lives around wellness,
Yeah,
particularly for COVID, and how people have been struggling a bit, just offering our words of wisdom and advice and support where best we can. So, do you
yeah,
want to give yourself an introduction, and
yeah.
we'll
Sure,
definitely get into the topic.
sure. So first of all, thanks for inviting me to have this conversation. I'm really excited. My name is Jericho Bulaun. I'm a transformational coach and speaker. My work focuses around cultivating mindful self-awareness for something I
Mhm.
love to call inner freedom, which is helping people to enjoy a life they love creating. Um, and I get to do that one-to-one. I get to do that in groups and in presentations and through conversations like this.
Yes, yes. And hopefully, everyone that's listening, you're going to get some tools on how to cultivate that inner freedom within yourself. Yes.
For sure.
So, tell me a bit about the topic. So, those of you that don't know, I kind of gave a few people some of the topics that I would like to discuss, but Jericho actually said, actually, I want to talk about this subject. And
Yeah.
I was like, okay, I'm down for that. I'm down for that. So, do you want to give a bit of overview what the subject is and why you decided to choose it?
Yeah, for sure. So the angle that I wanted to take was this idea of um, how can how can we maybe change the way that we address mental health
Mm,
um, in like our kids' generation, right?
mm,
Because previously, doing the work that I do and having the types of conversations that I have, I found that a lot of people in our generation, especially from ethnic backgrounds, haven't had that support, haven't had that the kind of safe space to talk
mm,
or experience their mental health issues because it's just been like you're being labeled as, I don't know, lazy, or you're being labeled as rebellious, or all these different types of labels. Our parents didn't know how to handle that, right? Our parents didn't know how to notice the signals, and our parents didn't know um, how to really resolve that for us, right? Or at least be a place where we're safe to feel those things.
mhm,
So we were just kind of taught this: keep a stiff upper lip, keep your chin up, all that kind of stuff.
mhm,
And what I wanted to address was how can we change that for ourselves so
mm.
that we can um, help our kids better in that respect, right?
Yes, definitely. It's all about changing that narrative. And when you brought the subject to me, I thought I could resonate with it so much because
Mm.
even me coming from a Caribbean background, a lot of the things that I may have experienced in my family home, I wasn't really allowed to talk about, let alone share with a therapist. Like, what? A therapist? Are you okay? Like, you're
Yeah.
talking to family to a stranger. So
Yeah. Yeah.
let alone offloading, like, I definitely found a lot of difficult things challenging to try and figure out where I can even begin. That's where I turned to journaling, because I thought no one knows what I'm writing apart from me. It
Mm.
can't judge me, you know, it's a blank page. My phrase is blank pages never judge you.
Right.
Um,
Right.
and yeah, it's just an offload, and at least my voice is being felt and heard by at least myself, if not by
Yeah.
anyone else. You know, but yeah, the subject is so, so vital. So do you have any children yourself, Jericho?
I don't. No, I don't.
Okay, no, I just thought I'd ask. I just thought I'd ask. Yeah, so,
Do I look like I've got kids?
well, anyone can have
Right.
kids.
Anyone can. Right. But yeah, no, I don't have any kids at the moment.
All fine. Because the reason why I ask is because I was thinking about this subject earlier on, and I talk about my son quite a lot. My son's 14, and I speak to him about just the day-to-day things that I do with work,
Mm.
and I talk to him about mental health. I talk to him, look, I'm not having a good day today. You know, just give me a bit of space, give me a bit of time. I'll be okay, but I just
Yeah.
need a bit of space. If I finish work and I've just been a bit burnt out, give me an hour and I'll be okay. Do you think
Yeah.
that's good advice? What's your opinions on that? Do you think talking with your children about mental health is good?
What, in terms of asking your kids to give you space, like when you need it?
Just in general, talking about mental health, your own mental health, their own mental health. What's your thoughts around that?
Yeah, for sure. I think, the most important thing that we can do, right, from my perspective, and like you said, I don't have kids, so this could completely change when I do eventually have kids, right? But is uh, what I feel like is the biggest opportunity that we have is to lead those experiences by example, right? And it sounds so simple, it sounds so cliche, but if we show our kids how we manage ourselves, then
Mm-hmm.
it might facilitate an understanding of, oh, okay, well, this is how I see my mum or my dad deal with this when they're feeling a certain way.
Mm-hmm.
They know what that feeling is,
Mm-hmm.
rather than just saying, I don't know what they're going through, and they kind of just went silent, and they.
Yeah.
So I think it's important to not just lead by example, but also to explain what those things are, because
Mm-hmm.
what happens, especially with younger people, if there's no label for it, if there's no word, if they don't have language to describe it,
Mm-hmm.
their mind just completely misses it,
And
right?
they
There's
make
no
them as well.
right. So they're
Oh,
they don't have a label to attach it to. There's no label for this emotion. There's no label for this scenario. There's no label for this situation. So their mind just kind of dismisses it as something that is not familiar.
yeah.
And so when you can communicate that and say, well, I was something was coming up for me, and I felt like this is the way I could manage it. This is the way that I allow it to process in my body. This is how it feels. Then
Mm-hmm.
maybe when they feel the same thing as you, or at least the way that you're describing it, they can also respond in the same way, or at least start to have this self-regulation, right? They understand how to be with the emotion rather than to dismiss it and say, I need to be strong. This is not the way I should be feeling, and just
Yes.
allowing that to exist, right?
Yes, definitely. I agree. 100% agree. And got a comment in there that says sharing truly works. And I agree. Sharing does
Yeah.
work. And I think it's sharing all times as well. So even when there's times of anger, times of sadness, times of happiness, especially as well,
Mm.
like you said, it allows them to not only understand a baseline of how to interact with their own emotions, but how to express them to others as well. And
Yeah.
also be able to ask for what they need in that moment when they're feeling maybe a bit distressed or when they are happy,
Yeah.
what they need from another person, you know, and that's all good part of good mental health, good mental regulation. So I know something that I posted in the caption was about acknowledgement,
Mm.
acknowledgement of older generations, of what is your insight into your own mental health and how does that impact the younger generation or your children. Um, what's your thoughts around that as well?
Around how do I address My own mental health.
No, the older generation. So I believe, for example, people my age, your age, we're very much in tune with what mental health is. We speak about it quite a lot. But even when it comes down to dealing with traumas that may have happened for the older generations, they may not be so freely willing to speak about it or even know where to get that help. What do you think would be that bridge that, you know, between the older generation and us? How can we kind of filter that down into the younger generation?
Yeah, it's a great question. You know, I think what was missing, right? What was missing for the older generation was like permission, right?
Yeah.
They never had permission to feel these things. It was just it was almost not allowed. It was taboo, right? You don't talk about these things. You're supposed to look a certain way. You're supposed to handle yourself in a certain way. And so all of those topics were just kind of swept under the rug, so to speak. So if we can facilitate an understanding of you're allowed to feel like this. This is completely normal. Also, you know, it's completely normal to go through these kind of these waves of emotion and feel lost, you know, and feel lost sometimes. It's completely fine. So I feel like for the older generation, they felt like they didn't have permission to do all of that. They didn't have permission to feel like they were quote unquote weak, right? It was looked at as, if you had these issues, you're weak. And if you, like you said, if you go to therapy, you're weak. And if you talk about it, you're weak. I think the bridge to that is allowing ourselves to be the permission, right?
Yeah.
We are the permission for our kids. We are the ones that create that permission so that our kids can live in the way that our parents didn't, you know?
Yes.
And also that takes, right, when we take on that responsibility, we have to live that. We have to embody that. So we have to allow ourselves to be caught in the chaos of our own emotions. We have to allow ourselves to be caught in the mess so that we can figure out how to be the bridge, how to allow our kids to not experience that, and not necessarily to not experience it in a way where it's like, I want to protect you, I want to keep you safe. But when you do experience those emotions, this is how you manage it, because I'm giving you that space to be able to experience that, right? Does that answer your question?
It does, to a T. Oh my gosh. Absolutely. And you know what? Whilst you was talking, it had me thinking a lot about whether mental health is deemed what it was back then. So what you mentioned about being strong, just continuing, not actually having to face up to things. A lot of the time, I feel the older generation may not have known that they were going through a type of mental health issue or breakdown. So, like you said, naming that pain, naming what it is that is hurting you, you know that something doesn't feel right, but you're just going to have to keep going anyway. How can you get that support? If you even need the support, you may not even think that you need any help at all. Just keep trying to remain brave and strong. And I know I've been this type of person, this type of parent, where I've said, no, I'm the parent. I have to remain strong. I have to keep it together. But in all honesty, is that doing damage, or is it doing the child justice? And actually acknowledging and accepting, actually, maybe I could do with a bit of help. Maybe things aren't that right. And admitting to yourself, like, okay, something needs to change, and you can go and get that help and that support. Yeah.
Right.
Just want to read out some comments as well, because I can see some hands, I can see comments. People are really resonating with what you're saying. So there's another comment here. As an older generation and as women, we gave ourselves permission to share, or permission, I believe that's it. It's true. I think a lot of these safe spaces that are being created now are you're finding a lot of healing coming out of them. I was talking on earlier on with a parent that has a very similar life to how I grew up, but their child is going through some things. But just having that space to share, even if it's not that therapeutic intervention, you've just got that talking space to feel that you can offload. and say what needs to be said without fear of judgment, without fear
Mm.
of comeback and things like that. But yeah, definitely resonate with what you said. So there's something else that I also wanted to delve in with you,
Yeah.
Jericho. Something that you mentioned on one of the podcasts that we we was on, and you spoke about vulnerability.
Mm.
And I want to kind of ask you, where do you think vulnerability fits into the strength in mental health?
Wow. Yeah, I think that's exactly where it fits, right? I think that is exactly where it fits. Vulnerability is the strength.
Mm,
That is the strength. Being the ability to be vulnerable, right? And again, it comes back to this idea of permission. Sometimes we don't give ourselves the permission to be vulnerable. We tell ourselves it's not allowed. We tell ourselves we shouldn't be putting ourselves in a position where we're vulnerable, or we shouldn't be experiencing this feeling of being vulnerable, right? But the shift is that if we can experience vulnerability long enough that we sit with it and we let ourselves feel vulnerable, then
mm,
what happens is it's almost like dirt settling in a pond, right? When there's like some sort of storm, the vulnerability stirs up, and then everything just settles down when you sit with it long enough. And then when this kind of clarity, this feeling of clarity is like, that's the strength that comes with the understanding of your own vulnerability, right?
mm,
And I just saw a comment pop up, the ability to open up requires strength. Exactly. And, you know, that
mm,
strength, you know, the kind of thread that I'm trying to explain right now is that strength comes from standing in your vulnerability long enough to
yes,
experience that you had the strength all along. Because
yes.
we label ourselves as, I'm not strong enough to experience this, I'm not strong enough to go through this, I don't have the confidence, I don't have the conviction. And when you
Mm,
just allow yourself to be vulnerable with no answers, you don't know where to go, you don't know who to turn to, when you allow yourself to feel like that and accept that
mhm,
that is something happening in you, then you
mm,
realize the strength is there anyway. And then you say, okay, well, is it possible for me to do this alone? And
mhm,
even if you feel like it's not, it's just the inquiry, right? You get to inquire with all of these thoughts. There's so many possibilities. You could get help, or you could you know, try some mindful practices. You could, like you did, journaling, you know, all these different types of things. There's so many possibilities of
mm,
way um of ways to deal with things,
mhm,
that being vulnerable enough to expose yourself to all of them is what I believe is the beginning of this strength, right? To stand up to and to experience all of these things from the inside first, right? It's a it's something that happens from the inside, and it emerges from you the longer that you sit with it, right?
mm. Definitely. So beautifully said. Gosh, I could just sit here and listen to you like, yep, go ahead. It's true. It's true. Being able to sit with your feelings, sit in your emotions, it can be so messy because it's traumatic somewhat. It can feel traumatic, but that's just your perception of
Mm,
being in that space. You need to change, reframe what it feels like.
mm,
And like I said, rename that pain, because at the end of the day, when it comes down to healing, it's going to be a turbulent process.
mm,
Always is a turbulent process. It's never smooth, but it's knowing that it's always a journey and there's always layers to be uncovered. Um, but yeah, yes, thank you, Jericho. And you mentioned about grounding, and this is something also that we spoke about on that podcast, which I would
yeah.
love to delve into more. Again, this being Mental Health Awareness Week and the theme being nature. A lot of people go
Mm.
outside and say, get grounded with nature. You know, like, what does that actually mean?
Yeah.
So explain to everyone, what does grounding mean to you?
What it means to me. All right. Well, I'm going to try to um, not avoid, but I want to give you my full perspective, right? Without the walking outside with no socks on, with no shoes and socks on, right? And exchanging the, you know, like the grounding frequencies and all that kind of stuff. Because I believe that that's something I subscribe to. I actually practice that myself.
Mm-hmm.
But I had a conversation the other day where someone was explaining to me um, a situation that they were going through. And she was kind of describing these situations, this kind of like series of events that happened that actually lined up really well for her to deal with something chaotic, something traumatic, right? And she said that she described the work that she did, or the kind of events that led up to this big thing. She described that as grounding. And it was like, the way she described it was, I was grounding myself so that when this big thing happened, it wasn't swaying me, right? It wasn't pushing me here or there. I didn't feel any extremes of any emotions. I was centered so that I could deal with this thing. And I said, you know what? Grounding is the ability to create and hold a space for your own chaos. Right?
Repeat this before you forget. Repeat
Say it louder for people at the back.
Yes, the chest. People need to hear that.
Right. So I said that grounding is the ability to create and hold a space for your own chaos. Because chaos, especially in your head, feels like you're up in the air. It feels like you're falling forever, and it just feels like so many things are happening. So many things are happening, right? And you don't know what to do. You're falling, right? There's no hope. You've got nothing. You're just kind of free falling through the sky, and nothing's going to catch you. You don't know, you know. And so grounding yourself is the idea of taking control of what you can control. Right? So you pay attention to the things that you can actually control, and then change them and do something about it. So the idea of grounding is, how can I create my own safety for my own chaos, my own problems, my own issues, right? And this also includes your own mental health, right? And it's, again, it ties back to this idea of awareness, because if you're not building this awareness, you're not going to notice the signs that your body is telling you, right? Your body is trying to speak to you all the time. Your body is telling you, you know, it's kind of guiding you from the inside. And what we do is we block off that sight by trying to look externally, like, where's the place I can go to? How can I escape from this pain? How can I escape from this chaos? So grounding yourself is this idea of creating this space for you to hold your chaos, so that you can be familiar with it. Right? We try to escape our pain. We try to escape our trauma. We try to escape our chaos. But the idea is, how familiar can we be with all of that stuff, so that we can speak to it, right? If I can give you a face, a name, and a, you know, a persona, I can speak to you. I can speak to this pain. There's a part of me that is painful, and I can speak to it, rather than saying that thing out there is making me feel this thing, and I'm just going to hate that thing forever, right? I'm going to resent this. I'm going to resent that person. It's, how can I deal with this on the inside? So that
for ownership as well, isn't it?
Sorry, say that again.
It has taken a level of ownership over your own mental health and your own well-being, your own choices and decisions, being informed about how you want to live your life.
Yeah, for sure.
So,
and it starts by making that decision, right? All of that starts by making that decision. You make the intent to take control of that, because you can, you know, I think a lot of us in the last year, or maybe in the last, I don't know, this kind of positivity movement has been really pushing in the last few years, and all this idea of positive affirmations. You can say as much as you want with your mouth, right? But if you don't believe it on the inside, nothing's going to happen. And we always have to make those changes at the level of belief. What do we believe about ourselves? What do we believe about our circumstances? What do we believe about the way that we should be living or experiencing life? And when you believe something different, you start to behave differently. And that's what causes lasting change. It's not this waking up every morning saying, I am powerful. Like, an affirmation is just an affirmation if there's nothing else that's holding it, right? And that's the grounding. That's the grounding. You ground yourself so that when you say this affirmation, it doesn't just float away, right? It stays with you. Does that make sense? I feel like I went on a...
It does. No, it does. And I just want to remember the two things I wanted to say, but in regards to... No, it's fine. Because you know me, I can chat. But it's one of these things where what you're just saying about positivity, it's making sure that you've got that balance where you're not blurring the lines between toxic positivity and
Mm.
not actually accepting the situation for what it is, and being delusional. In all
Mm.
honesty, 'cause I think a lot of the time, us as adults, we can sometimes blur ourselves into that line of delusion where we're thinking we're being happy and we're thinking we're being positive, but in actual fact, we're just trying to reject everything
Yeah.
that's happening and not accepting
Yeah.
it. Like, nothing's happening over there. Everything's all right and rosy over here.
Yeah.
But again, like I said, that grounding. So if we as adults can't get it right, imagine what children are doing. Imagine how children are feeling if they're still, getting all this information and stimuli from the world around them, and the hustle and bustle of even just us as adults in our own lives. Something that I've been researching a lot about is adverse childhood experiences and how different elements of an adult's lifetime can severely impact a child's mental health and
Mm.
trauma and invoke so much trauma. So I know we're going to round up soon, but any grounding techniques that you could think of for children that might be helpful to anyone that's listening, that, some kids might hear this later on or they might share this with some children. Any grounding techniques that you can give some children?
Yeah, for sure. There's one that is quite popular, so maybe some people have heard it before, but it's I don't know what the name of it is, but
Mhm.
it uses your five senses, right? And grounding, again, this idea of grounding is bringing yourself back to where you are right now,
Mm,
rather than getting lost and free falling in the sky, right?
mm.
So I can't remember what the idea is called or what the exercise is, but I like to call it anchors to the present.
Yes.
So it's just, and maybe you know it too, but it's just wherever you are, right? Take a deep breath
Mhm.
and you name five things that you can see,
Yeah.
right? You know this one. Five things you can see. I think it's four things you can hear, three
Mhm.
things you can smell, two things you can um, touch,
Here.
and one thing you can, and
Yeah.
then one thing you can
One thing.
taste, right? But
Yeah.
essentially you run through your senses and look around you, and what it does is it brings you back into your body, right? Because
Mhm.
when you find yourself getting lost in your chaos, you're having this kind of purely mental experience where you're projecting yourself into the future of
Mhm.
like, I'm scared this is going to happen, or
Mm.
you're like putting yourself in your past where it's like, oh, this is what happened to me, and this is why I'm like this right now. So
Mm.
this exercise, this grounding technique, is to bring you back to where you are. Look around the room, name
Mhm.
five things you can see, four things you can hear, three things you can smell, two things you can taste, and one thing you can touch. Something like that. But yeah, I hope that was useful.
It is useful because I think not a lot of people know how to practically and pragmatically support children. A lot of the techniques for adults sometimes are transferable, but children require a lot of direction, and it's something that you can practice by yourself. Again, with
Mm.
this whole self-regulation aspect of it, knowing what you can do for yourself, you're teaching your children how to maintain their own mental health by giving them a
Mm.
tool that they can perform by themselves. It's self-therapy at the end of the day,
Mm.
But thank you for that. I know we're going to round off now, Jericho. I could talk to you all day, but I know we could probably do a
Yeah, I
part
know.
two. We
No,
could
I
do,
love these. I love these conversations.
yeah, they're so needed. And, it's people like you that do the transformational work that the world
Mm.
needs right now. Because at the end of the day, when it comes to the next year or so, we're going to see how much the pandemic has affected individuals and also children as well. So kudos
Mm.
to you for doing what you're doing. It's been amazing talking with you. Before I
Thank you.
go, you want to tell everyone where they can find you?
Yeah, I mean, one of the best places is here on Instagram at Jericho Bulaun. You can click on my profile here. Also, my website, jerichobulaun.com. Some exciting stuff happening there fairly soon. I need to start telling people about it, but something's coming, and I'm really, really excited about it. So yeah,
Are you going to tell us? Are you just going to keep us in the
I'm
in the
gonna let
dark?
I'm gonna let people find me and navigate to the website. And
Oh,
then if they pay attention to my Instagram, my stories, then they'll find out. You know what? I'll tell you. It's a workshop that I'm doing. It's gonna be a workshop that is about coming back to who we are, right? So authenticity and being confident in the person that we are behind all the labels that we've been attaching to ourselves. So that's the workshop that I've been working on, and there's a program that's coming off the back of that as well, and I'm really excited to start working with more people. So there you go. You guys get, I haven't even said that on my own page yet, so
no, it's okay. Everyone, follow right now. All the viewers, go and follow Jericho. You've got the heads up. No one else knows about this, not even his own page. So make sure you follow. Make sure you get all the information, and make sure you join. I know I'm gonna. So, Jericho, thank you so much. Such a beautiful conversation. Everyone, I'm back. Why can't I talk right now? I've been talking too much this week. But I'm back again tomorrow at 7 o'clock with another guest. Again, you'll find out tomorrow who it is. Jericho, have a beautiful and most blessed evening.
Thank you so much.
Everyone, stay safe, stay well, and look after your mental health. All right, take care, Jericho. Bye-bye.